Alright, so with regards to how I would explain this activity to a client that I mentioned in question 5, I personally feel that it can work with a lot of clients that have different types of presenting issues that they come in with for therapy, as long as I am mindful of their cultural background and any practices or beliefs that they follow. So obviously it's very important to be mindful of that always. But I think personally, because it's such a basic activity that people can do anywhere and anytime, I personally feel that it's always important to remind clients why it is useful and beneficial to practice a activity such as a guided meditation. So for one of the examples that I will use one of the clients that I worked with previously. She was a 14-year-old teenager. She was Mexican American, and she suffered from anxiety issues, and she had a lot of troubles falling asleep at night. So on top of that, I also kind of tried to do a sleep hygiene schedule with her. But most importantly, I did practice some meditation with her. And the way that I explained it was, let's try something out. What is it that you do to decrease these feelings of anxiety that you feel when you're thinking about things that you are, or what do you do before bedtime so that you can try to calm your mind? And she stated that she had never thought about it before. So I asked her if she was okay in trying to do a meditation and a little body scan, and she said yes. So I explained to her that it would be a little bit awkward at first because, as humans, it is natural to be in a daily habit of just being on the go, whether it's going to school, going to work, doing internship like we are, and so on and so forth. So what I did was I asked her, okay, let's practice a few deep breaths. So I counted 1, 2, 3, 4, hold it in, and release. So we did that a little bit, practiced a little bit, and then she was kind of laughing, and she stated it felt a little bit weird, but she never took the time to do it as well, which is a common theme I am experiencing when working with people. And then I stated, okay, let's close our eyes now. So for this activity, what we're going to do is imagine ourselves in a calm and peaceful place. And a lot of the references that I would make during the meditation was, think about how you want to feel when you're feeling these symptoms of anxiety. Do you want to feel calm? Do you want to feel more present? Think of yourself of letting go of anything that you feel is having a hold on you. Take some deep breaths. Practice intentions. Today, I want to feel great. I want to feel relaxed. Or for this person as well, today, I am clearing my mind of any sort of thoughts that I have had throughout the day, because I want to allow myself to feel calm before I get a good night's rest. So a lot of that focused on how I was able to ground her, help her get grounded, help her take some deep breaths. So I was practicing that with her, let her kind of laugh it out because she was a little hesitant at first. Then I also was just trying to guide her as much as possible, checking in with her. How are you feeling? Do you want to stop? Do you want to continue going? And I would also ask questions after. How do you think that you would practice this in your daily life if you feel like it helped? And she stated, well, it's not really something that I've ever tried to do because it feels weird, but during the times where I'm feeling really anxious, I would try to take some time, whether it's taking a walk really quick or something, or doing it before bed, something that I do want to practice. So that was my experience, and that is also something that I would continue doing based off of every individual and what presenting issues they bring, and so on and so forth. Always be mindful. Thank you.